Most of our patients are having the procedure because of significantly disruptive periods, either heavy or bad cramps or both. Usually the recovery is going to be no worse than your next period. You usually have some degree of cramping. You might have menstrual cramps maybe for a week. The first maybe 6 or 12 hours, they'll be pretty significant, so we normally will give you some pain pills. But after the first day, it's kind of like a menstrual cramp. You also have some vaginal discharge. Instead of bleeding like your next period, the temporary uterine lining is removed, so you will not have bleeding afterwards, but basically a watery, clear discharge that lasts maybe a week. So really, recovery is cramping and some discharge. I've had some patients go to work the next day. It's really, for many patients, not a big deal. If you had it done towards the end of the week, clearly take it easy over the weekend, and by Monday you're back doing all your normal stuff. NovaSure should not be considered contraception by itself. It interferes with fertility, but it's not absolute. And a pregnancy after an ablation could be a dangerous situation in terms of the pregnancy being in the tube or an abnormal part of the uterus, and that could be a problem. So definitely you cannot count on NovaSure by itself being contraception. Some type of birth control will be necessary after the NovaSure ablation. If you can talk your husband into having a vasectomy, that's great. If you want to take care of it yourself, you could have a tubal ligation, but that's an operative procedure in the hospital. And basically you're operating in the abdomen, which of course if there's a complication or a risk, it's in an area where there's lots of blood vessels, lots of potential complications. The two best choices probably, if you want to take care of it yourself, either Adiana, which is a procedure where we go through the cervix, we actually go up into the uterine cavity and block or occlude the tubes from the inside of the uterus. So there's no incisions and there's no surgery. Very simple in-office procedure that will offer you contraception. Doing the Adiana procedure does not prevent you from having an ablation later on. If you've already had an ablation and now you realize you need contraception, then I would recommend the progestin-only pill. The regular classic birth control pill has estrogen and progesterone in it. That's what makes it so effective, and it regulates your menses. So patients feel comfortable and they have a predictable flow.